Do you offer breast lift with implants, are one procedure or separate? I'm guessing that should say as one procedure. So yeah, I do it as breast lift with implants as one procedure, aka augmentation mastopexy. So breast lift with implants, I do it as one procedure, and this is for those of you who perhaps haven't researched it or haven't looked into it. If you look into it, if you look into augmentation mastopexy or breast lift with implants, it's just a different name for the same thing. Um, it's something that's not unusual for plastic surgeons to not do in one operation. Um, they'll do it in two operations. They'll stage it. They'll either do the lift first and then the implants, or vice versa. Um, and there's very good reasons for them to do that. And the good reasons for them to do that is that the complication rate is less, because if you do a lift, you're making the skin all tight. If you then put an implant in, you're making it tight again. You're increasing the risk of wound healing problems, wound breakdown, wound infection. If the infection gets to the implant, you have to remove the implant. So a breast lift with implants as a one-stage procedure has got a high complication rate. So it's much safer to do it as two stages. The problem with doing it as two stages is that you need to be 4, 5, maybe 6 months between stages. So you're looking at a year to sort of get everything sorted out. So that's quite a big thing for people. And a lot of people say, look, I just want to get in one stage. I want one time off work. And, I don't really want two stages, because I know I'm not going to be happy if you just put implants in or if you just do a lift. So I'm going to be unhappy for 6 months. So I think personally, I do it in one stage. But if you're borderline, if mainly the shape's the problem and not really the volume, I might say, well, look, should we just do a lift, see how it goes? You might be happy. If you're not happy, you could always have implants at a second stage, and that's actually a safe way of doing it. So I will often kind of encourage patients to consider doing it as two stages, because it is safer that way. But I completely understand for those patients who say, look, you know what, the shape's not right, the size is not right. I'm not going to be happy if you just fix the shape or the size, because implants will make them bigger, but they don't really make the shape much better. Lift will make the shape better, but they don't really make them any bigger. So if it's a shape and volume problem, then I personally do it in one stage. But I say to people, look, it's got a high complication rate, etc., etc. But it might suit you in terms of what your goals are and what your life is in terms of work and all that sort of stuff. So yeah, I do it in one stage, but many doctors don't. And it's not that they're wrong and I'm right. It's just everyone's got a different view. That's the beauty of plastic surgery. It's everybody. Well, I say beauty. It's a bit of a nightmare, I guess, if you're a patient, because you'll find that there are different opinions amongst plastic surgeons, and someone will say, "Oh, I do it that way. I do it that way," which is the right way. There isn't one. It's just what we've experienced in our lives, kind of thing. There's no one who'll say you must have a one stage augmentation mastopexy or you must have a two stage. There's people around the world doing different things, and it's saying I don't do it that way, I do it this way, and the other guy says, well, I do it this way, you do it that way. Just you just got to hope the person has got a sort of rationale for what they're doing. They're getting good results. They're getting good feedback from patients. They're going to look after you. That's what I would focus on. And the technicalities of it, don't worry too much if people do different things.